Good morning, everyone. We'll call this meeting to order. It is December 7th, Monday. This is the Broadwater County Commissioners' General Business Meeting. It is 10 o'clock. If you'd please join us for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Just a little bit of housekeeping before we get started. This meeting is on YouTube and is recorded, so please state your name for any public record that you would like to submit into the record. We follow Robert's Rules of Order, and that is to keep civility in our meetings. All comments should be directed to the board chair. So with that, we are at public comment. Is there any public comment anyone has to offer? All right, we will move on then to Montana Minute. Franklin, do you have a Montana Minute, something good to say about our community?
Well, it's not a Montana Minute, it's really not good, but this is the anniversary of Pearl Harbor, so it's, and with all the turmoil going on in the world now, it kind of reflects back on that.
Thank you very much. I would like to echo Pearl Harbor and just reiterate that Montana has more service personnel per capita than any other state in the union, and we need to thank and remember all our service personnel, current and active, retired and past, as well as our volunteers and public safety personnel. Any other Montana minutes? All right. Commissioners Community Update. Franklin, what did you do this week?
Yeah, Wednesday attended the policy review with our HR person. Several department heads were there also.
All right. I did the same policy review update. We had two this week. The first one was very well attended. The second one had 9 people, but we got a good number of people covered. Just have to get every employee covered, and we expect to adopt those in January. The Missouri River Fund meeting was this week. We meet once a year, and every dam, except for Toston, on the Missouri or Madison rivers, a fund is funded by Northwestern Energy, used to be PP&L, whoever owns those dams, and that money is used for recreation. We had about $500,000 to spend this year, actually about $340,000. So that was this week, and then we also had a meeting in Red Lodge to investigate their public health structure and how that works for the public in taking public health to people. And we'll be meeting on that a little bit later on this afternoon, or this morning. So with that, we don't have a clock on the wall, but I brought my phone. We're a little bit early, so we'll do some mail. It's 10:03. Pretty sparse today. We have the approved claims from last week, and that is in the total of $31,128.21.
I'll make a motion to pay the approved claims as the amount stated.
I'll second. It's been moved and seconded to pay the approved claims in the amount of $31,128.21. All those in favor of the motion, please signify by saying aye. Aye, motion carries. I should announce that Elaine is home ill if I didn't. There you go. And we have minutes from November 23 and November 30. Thanks, Ann. Those were sent out to us the last 2 weeks, usually on Tuesdays.
And I had a correction on this.
It's in there, Franklin. Second page.
assume the other one is same as center. Yeah, we'll accept the minutes.
Which one, or both?
I'll accept both of them.
I'll second the motion. It's been moved and seconded to accept the minutes of November 23 and November 30 as submitted. All those in favor, please signify by saying aye.
Aye.
Aye, motion
I should
carries.
add to that, after the change was made on the November 23rd minutes.
Franklin, that doesn't have to be added because this is the set that is not the draft,
Okay.
is not the one that's being accepted. This is the one that's being accepted.
There's one. And there's two. All right, we also have two letters of support. These are both to the Montana Board of Investments. This is not anything the county is doing, but the Board of Investments, Intercap, is looking for our support. The first one is the Hospital District Board is requesting a loan that uses the mills already voted on by the citizens to make the Medicaid overpayment payment. Medicaid, as you know from our report from Jenny last week, overpays Broadwater County. This is done with several small community hospitals or medium community hospitals. And at the end of the year, when they do the cost report, they have to repay that overpayment. So what they have done is use the collateral of those mills and took out a loan to go ahead and make that repayment. This is a letter that reads to him as...
Is that the 120,000 loan?
No, this is for $474,000. And the loan repayment was expected to be 400-ish, and it's actually 680, I think. So this covers a big chunk of that and protects their operating cash so that they can continue to do their business while they get this worked out with Medicaid. So this reads, the Broadwater County Board of County Commissioners realizes the importance of having a hospital for our local economy, school, families, and business climate. We have worked with our hospital for the good of our community and appreciate this opportunity to work with Intercap and the Montana Board of Investments to secure a loan to help with repayment of Medicaid overpayments. Board of County Commissioners agrees to levy all voted for mills and continue to meet and work with the Hospital District Board. Thank you again for this opportunity. Again, this is not a loan for the county. This is our supporting what they're doing and pledging that we will go ahead and levy those mills. So I think as we did not have anything to do with this loan, we should have a vote to sign the support letters. The second support letter is for the second loan, which is in the sum of 120, is 160, do you remember? I have the email here. And that one is for building maintenance. It is a county building, so without this loan, without the hospital, of course, the county would be obligated. So what this letter says is that we will agree to pay the 10-year loan at about $20,000 annually should they default, which is not expected to happen as they have targeted that they can afford this repayment. Do you want me to read the letter in full, Franklin?
No.
Okay. What's
My
in
understanding was that 120,000 was the one to cover when the mill levy come in, of the one that didn't get to them this year.
No, that would be, they were looking to refinance some higher interest loans, and they couldn't do that through this program. So this is just the Medicaid repayment, using the mills as collateral, and the business maintenance and upkeep. And that's for about 163. So will you move to just sign these letters of support? That's all they are. Okay, for the record, I will move to support signing both letters to the Board of Investments for hospital building maintenance and upkeep, and Intercap loan for Medicaid repayment, support letters only. Is there a second? I'm gonna take that as no second, so motion dies without a second. So we will table that till next week. We also received in the mail another letter from Department of Administration. This we are challenging currently, and we'll be speaking with our county attorney about a little bit later. This we have been working on for about the past year, a year and a half, actually. But 10:11, so we're a little bit early. Are you Jim? Hello, Jim. You're Todd?
Todd, yeah.
Nice to meet you both. We're about 4 minutes before our next appointment, so just in case more people want to come in and listen, I'm gonna wait until 10:15, as that's the advertised time. Actually, you guys are due at 10:45.
Is
Did
it
you know that?
10:45? Oh,
Yeah.
okay. Yeah, that was 10:30.
Okay, you're welcome to stay, absolutely, but we do have 2 appointments before you.
Okay.
All right. Dana, with that, I don't think that most of our folks are here to listen to you, but if they are, I think we can still get started 3 minutes early.
Okay. Basically, I mean, as cold as it's been, we're just stockpiling right now out of the line plant, so trying to get some of that stuff done. I'm gonna have to look into maybe widening a couple bridges, possibly one of them on Sand Hill and the other one on Cottonwood. I'm having some trouble with my bridge signs getting knocked over all the time, so I'm thinking what's happening is they're too narrow. I mean, we've widened most everything we've got, and those are the only 2 bridges that I can see right now that we're having problems with.
Now, are those culverts or concrete?
They're bridges, they're concrete bridges. So, you know, I mean, the one on Sand Hill is actually a little narrow for the equipment that's going over them. I mean, we got Bruce Seed, Joe Nelson, Leonard Lambot, and I mean, it's the way it is. You know, most everything else we got is pretty good because we widened them all. These will be the only 2 left. I'm gonna see kind of what it'll take to do that here in the next month or so.
What about the knockdown side, they go through and they spring back up?
Well,
They work or?
I don't know if they will. You know, I thought the ones we put on there would work, because, I mean, they fold right flat down on top of the bridge.
But they don't come back up unless you manually do it. Is that
Well, they
right?
do, but, you know, it's not that tough, just step out and do that,
Yeah.
but people don't do it. You know, and then, you know, they're scraping them up, you know, they're bending them up, you know, just the signs themselves, you know, I mean, the swing arms actually are holding up good, it's just, you know, I kinda, I don't know, we lost a couple bolts on the, out of concrete, but, I don't know. You know, I mean, we could figure something else out. I know Ponderay County's got something in effect that they're cutting their signs down a little bit. You know, somehow they did a resolution, and, you know, cause federal and state mandate, basically federal mandate is, you know, you gotta have, you know, the 4-foot bridge sign. But they did a resolution where I think they're only, I'm thinking 12, 14 inches or something like that, and right down on the face.
Could you make something that's on a swing arm that swings horizontally and is set up so that gravity would bring it back?
Well, yeah, I don't know about horizontally, but they've got some deals out there that are spring loaded. And when you go over the top of them, I mean, they spring down and they spring back, you know. I just don't know how well they hold up. I've looked at some, you know. you know, I guess a guy could try them, they're expensive. They're $150 or,
Widening the bridge is expensive too.
well, it
And
is.
these here, I like to see them try, but.
Well, we can try 'em.
A swing out would work, 'cause some of this equipment is really wide when they're going through
Yeah,
it.
you
It's
could put
really-
like a 2-foot swing arm or 3-foot swing arm on there. And
Yeah.
so, like I say, either a spring or gravity. Well, it's on a little roller, it's on a little cam, and it would just roll right back down again.
Myself, I'd rather see the spring loaded down and up, because there's so many different, on these toolbars, there's so many different pieces of equipment, sometimes they're pulling, you know. It'd be just, I think it'd be catching if they swung out, where if it stayed
Yeah.
down all the time.
Yeah. And
I mean, it'd be a good
think if
experiment
you
to try it.
You know, at least one set probably, and
Mhm.
see. You know, I hate to spend that much money, it's gotta continue to get all tore up, you know. But we can try 'em.
And I know what you mean by the ones that lay down. Most time, they're not gonna go back and stand them back up.
No, and, you know, I travel enough of them, my guys are on enough of them, you know, we usually stop by and pop them back up when we see them down, but, you know.
But it's done on a Friday, they're down till whatever, you know, and it's equipment's moving all the time, I mean.
Yeah, and the only thing I've seen is the bridges we've got them on that are actually wide enough for the road, I don't have any problems. I mean, they're always up, so, you know, that's kind of where I was going with that, but, yeah, we can try them and see, I can get,
Daniel, what are the widths of those two bridges?
I don't know. I
Okay,
haven't
but
got
they're
that
not
with me
wide
right
enough for the
now.
road, is there a safety issue there?
They are not as wide as they should be, I mean, they should be as wide as the road, 24 feet, and they are not that.
Okay,
But, you know, I got the measurements at the shop, I can even go out and measure them and see, but, you know, we can check on it and see. It's not a big heated rush, it's just those bridge signs actually gotta be there. Just, there've been some lawsuits, you know, in different counties, because they weren't, or visible, so. But I can
okay,
check into that later.
thanks.
Let's see, threw a little gravel in that Centerville Road, it was really beating out that out here by the mill. You know, we actually, the mill bought some chloride for it and stuff, and we magged it this fall, but, I don't know, that bunch of snow and stuff we had earlier, I think maybe potholed it out, but it was pretty rough, so it's real good gravel to deal with. I see I got an email on that flap grant
Yeah.
situation.
Yeah,
Now, is that just so we can get started on this Goose Bay thing? Okay.
it's gonna take some time to write it.
Oh, yeah.
It has been, I understand, targeted as one of the most important. So we stand really on firm ground
Okay.
with that. But it'll be up to, BOR to still be in agreement with that. What Dana's talking about is our road to Goose Bay Campground is very rough, a lot of washboards on that road. We worked with Shannon Lewis from Senator Tester's office and the Bureau of Reclamation earlier this year, or a year ago, on paving that road and using the Federal Access to Federal Lands grant, which is under the transportation bill that just finally got out of Congress. So what we need to do is write the grant. VOR will actually be paying the match, and then our road crew will add actually just a little bit as compared of in-kind
Yeah.
for the match, 13%, right?
Yeah, what much, I think we were talking, well,
30,000. I remember that as well.
I talked to Sean, he's under the understanding that BOR will take care of the match.
Correct, ours will be,
Yeah.
yeah.
But I mean, that include that
Yeah,
13.
well,
Our 30,000 would be work, not money, not
Yeah.
cash.
and we could make that pretty easy, I mean, it's,
Yeah.
because it'll take some time to do a couple things to it, but if that'll work, and so are we, now do we need to set up another meeting with BOR?
At this point, I think we're just good to go. We need to get it written first.
Now, is WWC taking care of that part of it?
Mhm.
Okay, 'cause I know I got a call from Sean on just this Deep Creek stuff and some Dry Creek stuff here that's came through here in the last few months here, so,
Yeah.
anyway, okay. But I gotta sit down and visit with Sean one of these days on that Dry Dry Creek stuff or Deep Creek stuff here, so.
Okay. And the flat grant, if you do follow up, Jeremy would probably be the one
Alright.
writing that. He's been the one attending the meetings.
Yeah,
Yeah.
yeah.
Yeah, I think the whole of that Deep Creek stuff is that endangered orchid plant that's there, see, they're gonna have that study on that.
Yeah, yeah, but from my understanding, we've got, you know, we've got pretty much got grant approval for that. Just a couple bridges and.
That's the only stumbling part of it, I think, yeah.
Yeah, we do.
So that'll be good. Okay. This is about all I got, really. Not much.
All right.
Just thought about you guys haven't heard anything.
No, Home's been pretty good as far as roads.
Good.
A little bit of work is needed in the Raidersburg area. Talked to a couple citizens at the Christmas stroll. Downtown Raidersburg, there's some potholes going up to the cemetery. And I understand this time of year, probably a permanent fix isn't possible, but they wondered about maybe in the spring having something done.
You're talking on Parker Loop Road or Jones Hills Road?
She didn't mention the exact road, but she said the one going up to the cemetery.
Okay, that's.
Well, before it was on Brown Street there in Raidersburg.
Yeah. Yeah, that's a long ways from the cemetery.
Yeah, yeah.
Yeah,
So-
that's down there, Jones Hills Road, evidently.
Yeah.
It's probably
She also
okay.
mentioned downtown. She mentioned a few, 437 too.
Well, yeah, probably downtown, probably right down there by the school. I
Yeah.
was through there not too long ago, and there was a few potholes right there, but, yeah, okay. All right. Sounds good.
I heard general Raidersburg, and then I heard the specifics of the roads, but not the names. Yeah, so
All right.
that's
Okay.
all I've heard.
Sounds good.
All right.
All right.
Thank you, Dana.
All right, I'll check on this spring loader deal. I'm gonna take it in there just to for sure, make sure what they are. See what, get a couple comparisons, I guess. I know that sign will be cheaper, but I don't know. If they're not wide enough, they're not wide enough, and we can work on it through the next couple of years. Won't take much to do on really, I mean, it's pretty simple.
All right.
Just money.
Right, right.
All
Thanks,
right.
Dana.
Yeah.
All right, I'm guessing we're a little early again. We are 7 minutes ahead of time for our next appointment. Is there anything for the good of the order that you wanted to bring forward, Franklin, in business?
No, not right now, I don't think.
One thing we need to do is a follow-up training on the personnel policies for the department heads who did not make the meetings last week. That should maybe take us an hour to an hour and a half. Are you good with the 16th at 10 o'clock for that? We can do earlier to accommodate our department heads better. 10 o'clock is our usual start time. I don't have a preference.
16th, yeah, I'd say we should do it at 9. Earlier the better.
Okay, so, would you be available at 8?
Yeah, I can make it whenever.
All right, I will send out an email to those department heads who missed and see if 8 o'clock works for them, and kind of give them the choice if that is good with you.
This is just for the ones that haven't made it.
That is correct. Yep. here's the email on those, support letters. And here's the totals at the bottom, so that you have that. If I could get that back for the record, Franklin, if you want a copy, I can certainly make one. I just wanted you to see that. Thank you. Jan, we did not get those support letters for the district board.
Okay.
And Elaine is ill today, so we'll have to table that and readdress next
Okay,
Monday.
all right, thank you.
We're 3 minutes out from our next appointment. So if, once we're done with mail, if Brenda isn't available today, we'll go ahead and just recess for 15 or so minutes. But we'll give Brenda a couple more minutes.
She's
Brenda's gone, she,
Oh, is she?
She's
Yeah.
out of town.
Oh, okay. Is
She
Wynn
had,
here? Do you
Wynn's
know?
sick.
He is?
Yes.
Okay, our next agenda item is Brenda Ludwig, Sheriff Monthly Update. So, I am still gonna give it till 10:30, but I think we're pretty safe to recess for 15 minutes. So we'll give 2 more minutes and then probably make that decision. I'm not gonna recess quite yet, I'm gonna give it till 10:30, just to be sure.
What time do you guys want to do the Teamsters thing? Is it today or is it Wednesday?
You know, it is today, and since it is a, issue that was tabled from last week, we could readdress it any time, and Brenda's sick, or Brenda's on vacation and Wynn is sick, so they're gonna miss their 10:30, I think. I was just gonna recess, but if now's a good time for you, Floyd, you could do it now.
Okay.
Haven't recessed yet, so we're still in session.
Still in session? Okay,
Yeah.
so let me go pull it off the printers.
Okay, sounds good. Yeah, I don't know where you went. All right, the items on the agenda are subject to change. So we will be discussing signing the Broadwater County Sheriff's Office collective bargaining agreement with Teamsters. You want to just come up to the table, Corey? This was a subject last week and was tabled.
Well, it was tabled last week because we found a number of things within the agreement that, the draft that had to be corrected. So, I've been through this document a couple times with the Teamsters business agent, Aaron Foley, and we believe we've addressed all of the issues that were discussed. One is the term, the term is through June 30th, 2018. We agreed on a 3-year term. I'll just recite them briefly. There were some typos in various places. There was a question on the health insurance, which is in Schedule B, I believe. I'll go there next. That was kind of one where there was some dispute over what needed to be said. So actually, we'll start with Schedule A. Schedule A is just the compensation. And the county agrees to and shall contribute monthly to the Montana Teamsters Contractors Employers Trust Fund, Class 14 for health and welfare for all eligible county employees. At the draft, it had a specific monetary amount in there, and that was taken out because that may change as health costs change. Eligibility shall be based on 120 compensable hours the preceding month, and the draft had said 80 hours a month, which was an error. And it's effective December 1st this year, not retroactive back to January 1st, which was an error from the previous draft. And then it excludes seasonal employees. So that's the correction there. And there were a number of formatting things we did to actually make it more readable, but substantively the other change was on page 17, the detention nurse. And the detention nurse starting salary was a question. And I understand that the goal, and I went back and I looked at my notes and the sheriff looked at her notes from the negotiating session. And we had both written down the same thing, which was equivalent to the county nurse, the public health nurses, and that we had put them in the range of $20 an hour. So we did not, it sounds like, and we all agreed on this and talked to this whole, we did not agree on an exact number for the starting wage. There was those, within those parameters of equivalent to the public health nurses, and that we had said in the neighborhood of $20 an hour. So, so I just put on page 17, I just put $20 an hour because I didn't know what that actually was going to be, and so I put that number to bring that to you. That's probably the only issue that is still kind of needing to be resolved. The rest of the issues were all things we agreed on, we just had to make the language match. And on this, Foley said she understood that I was gonna put $20 and tell you $20 a day, and she said, just tell me what the commissioners do. So, that's other than that, we believe this thing is ready for signature and matches the agreement that is free of errors.
One question, Brenda and I both last week thought that the health insurance information as the contract and agreement should be taken out of the CBA. Did Aaron address that at all?
And what had happened is, since that time, we went back and looked at the language from the previous CBA, and the previous CBA had referenced the health insurance in the equivalent paragraph. It wasn't as long or as detailed, but it referenced that. And so, as I went back and looked at that, comparing the two, and then looking at my notes, it was my understanding that we did intend to put, at least in there, that the county would pay the health insurance. So that's an important part of the CBA. So what we felt was too much detail was the actual monetary amount, and so that part was taken out. Is that adequate,
is.
or is that satisfactory or not?
It is, it does, the dates are different, but I guess since it calls out its date of being effective 12/1, that's okay. And I think our employees really like it, so I don't see a change coming,
That
but
was
it
the
does
other
lock
thing.
us in, right?
That was the other thing, was we had the wrong, the date, as you pointed out, the date was, they're different and the date was incorrect on it, so. But what do you mean by it locks us in?
Well, say another company, and annually we get other companies that come in and say, we've got a plan for you. The Health Insurance Committee looks those over, and for the last couple of years, they've looked at Teamsters, excuse me, and said they can't come close to Teamsters, we're gonna stick with Teamsters, and annually we look at that. So if another company came in and said, we've got a better healthcare plan, would we, since this is in the CBA for 3 years, would we have the ability to step out of the Teamsters Health Insurance and adopt this new company, ABC Insurance?
Not without modifying the CBA.
Which Teamsters would have to agree to, right? So, is, in that way, is it smart to have it in there? In the short sight, I don't see a change coming, but you never know what'll happen in a year or two or three.
Well, it was never, and that's a valid question, but it was never part of our negotiations last summer to contemplate separating that. So I guess this would probably be a new discussion for the negotiations.
I'm okay with language that says we'll provide health insurance. I mean, we're obligated to by law anyway. I don't see anything coming, but it makes me a little nervous to have something so concrete that we cannot get out of it if we want to for 3 years.
Why and so is the comfort level, they'd like to hold off on this still and resolve that issue?
I'd be happy
Pursue it more?
adopting it as long as we can take it out and then have,
Well,
you know.
if it's approved and it's part of the CBA, then the only way to take that out is to reopen or modify the CBA.
Okay,
So,
I'd feel more comfortable with some clarity on that,
okay.
especially since this is a contract for 3 years. I hate to table it again, but one more week to protect us from headache in a couple of years seems like a good trade.
And I'll go back and relook at that. I did look at that, and I didn't have any notes, and I remember all the meetings pretty well. Remember at any point where we did discuss this as the option of going to another health insurance, but it could have been an underlying assumption that often happens. People have underlying assumptions that nobody says because they're underlying their assumptions. So, and since the sheriff's not here today, it might make sense to look at that again. Is that all right?
Yeah, it is,
Okay.
is it? All right,
Okay, so we will not be signing today.
thank you.
Is Commissioner Gravely gone?
She is, yeah. So,
Okay.
Let's see what time it is. I don't have a clock on the wall. We have another appointment in 4 minutes. Are you still available to maybe come and talk with us at the end of our meeting? It's just we have a vacancy in the department, and so there's an option to look at some different job descriptions that might affect your department
What will
in a
be the,
positive way.
what will be the end of the, what time is the end of the meeting?
Probably about 11:30 to noon. Okay, thank you.
And I'm just doing catch up because of the last week's trial, so I'll be around the whole time.
Okay,
I'll go over to Sheriff's office.
thank you. We have about 3 minutes. I'm gonna let more folks come in who might wanna listen so they can get the whole conversation. So we'll just sit for 3 minutes if it's okay with everybody.
That's okay. Oh, careful. I like you, but not in my lap. Okay. Yeah.
What did you do?
I just heard it. I didn't touch her first, honestly. Yep, I'm an inmate, yeah. Okay, thank you. Just making sure about when you're crocheting for the in-between times. Okay. Okay.
Just had hip surgery is all.
Oh, okay, I'm sorry.
I'm fine.
Okay, well, and no wonder it's hurt you.
Yeah.
That feels good to tweak as well, yeah.
Okay, we are at 10:45. Misty Sandgray and the Montana Department of Public Health and Human Services, Communicable Disease and Prevention Bureau Chief Jim Murphy, overview of public health services and models. And before I turn the floor over to you, Jim, I'm just going to just clear up so that we're all on the same page. There is no discussion or desire to get rid of public health or the Board of Health. We understand as a commission that we are statutorily obligated to provide those services, and we want to. They serve a different clientele than your local hospital. So I just want to make sure we're all on the same page there. The thing is whenever you have a vacancy in a department, you reevaluate the job description before you go out to hire. Same thing, when a department head leaves, it is a great time, it's been done over and over again, to look at that department. Are we doing everything that we could? Are we providing all the services? Is there more that hasn't been thought of that we can look at another model and adopt? Is there ways to do what we're doing with more cost effectiveness? Those are just some of the things that we're obligated to look at as the people in charge of the budget. The other thing we need to do is just look at a time study. We have a contract with WIC to offer services in this community We also provide those services to Mar, Whitehall, and Boulder. Is the contract covering our costs for 2 nurses, travel, expenses, wear and tear on the vehicle, all the things that go with that? We just need a time study to be sure. Again, to the question, is that the best way? Perhaps, but when our public health office is closed, what do our folks think about that? How do they feel? So these are some of the things we need to bring in the public and get some response and put some questions out there. There are different models throughout the state. Is ours perfect? Maybe. Is it perfect for us? Maybe. We don't know. What we want to do is just get some input from other counties. There's a model in Carbon County. There's a model in Yellowstone. There's a model in Beaverhead. There's a lot of different counties that we can work with, those public health offices, commissioners, and medical staff to see what's the best model. And at the end of this, perhaps ours is perfect for us, but it helps to have that research done, that investigation, so that we know definitively that's where we're at. That's all we're doing, and this is just practice we do when we have a vacancy. So with that, Jim Murphy and Todd Harwell, thank you gentlemen for coming, and I'll just turn this over to you guys and let you help to educate us.
Just grab any.
Absolutely. Nice to meet you too, Todd. I'm Laura Over.
Nice to meet you.
And Jim, were you here a year and a half ago?
I was here a few months ago, actually, for Board of Health training, and a few times in between. So if you want us just to jump right in.
That would be perfect.
Okay.
Yes. That'd be great, yes.
It's our understanding that, like you said, there's a vacancy in the department head. You're looking at other options, other models of delivering the county health services. So what I was asked to do was come down and just talk to you a little bit about the state perspective on this and what kind of models we see from the programs we work with. So just a little background on my bureau. The Communicable Disease Bureau houses some of the programs that probably work most frequently with the county health departments. We have the communicable disease and STD programs, or sexually transmitted diseases. Every county struggles with those. We have the immunization programs within our bureau. We have the public health emergency preparedness programs within our bureau. And we also have the sanitarians within our bureau. So our bureau probably works a little bit more directly with the county health departments than most others. So we have a pretty good sense of the models that are out there and, kind of how they're doing. What I put together here for you is a little bit of an overview of how they're administered. And you can see from the top slide there that the traditional model, meaning a county-administered public health department, is the most typical model that is out there. With about 71%, or 41 out of the 58 health jurisdictions, and we're counting tribal health jurisdictions in that as well, using that kind of model. The next highest model out there is pretty much a combination between the tribal model, which really isn't applicable here. The tribal health departments are quite different. They don't have the same statutory requirements, for instance, so you can kind of take those out of the mix. The hospital administered models account for 7 programs out there, or about 12%. That's usually the other model that counties look at during these transitions. Hospital programs are those where the county has pretty much subcontracted a lot of the public health administration responsibilities out to the hospital. And that's detailed on there. The next few sheets of this spreadsheet are details county by county with contact information of the lead local county health official and the Board of Health chairman. They are grouped by the different types of models they have, and then there's some pretty subjective comments over on the far right about how we think their models are working. What you'll see overall is, from the DPHHS perspective, the Department of Public Health and Human Services perspective, it's about the people and the resources that are committed, no matter what model you have. There's traditional models out there that struggle because of resource issues, and from our point of view, do a pretty much minimal approach to public health in their areas. There's hospital models out there that do struggle. There's hospital models out there that do quite well. The ones that do well, whether you're traditional or hospital, are typically those that have devoted enough resource to the issue, enough staffing, where they have a full-time public health nurse, sometimes more than one full-time public health nurse. Sometimes they have a dedicated administrator that may or may not be a nurse, that does the business parts of the office. These models usually fare a little bit better when we look at how they respond to disease issues and how they perform on our contracts. It really doesn't seem to be a discernible difference to us between who administers it. It's the resources and the people that they pick to run it that makes the biggest difference. I guess the last comment I would make is that these transitions are always difficult. We see this over and over again when a long-term staff member such as Lily Campbell leaves a department. There's always a little bit of what we call an identity crisis that goes on at the local level. And it's normal to look at the options that are available to people. What we see is that people come through these transitions pretty successfully if they communicate well with the staff about what their intentions are, and they communicate to the hospital and the community health centers or whoever else they are looking at potentially partnering with about what some of the expectations are. Public health is different as far as services than what most people consider medical health to be. You know, the best example we can give people is that a doctor's office or a clinic looks at pretty much an individual's care, one person at a time, your care. Public health is supposed to step back and look at the population's care. They might be the provider of last resort for some of that individual care, such as immunizations in a lot of our jurisdictions, but generally they're trying to step back from being that direct service provider and look at the health of your community overall. Public health departments wear a lot of hats. Again, they have to be both sometimes, and that can put them in difficult positions, but they do an admirable job of it. With that, I really would turn it over to you guys for questions. I don't know if my boss, Todd Harwell, has anything to add, but we can have some discussion.
The only thing I'd add is a couple things. One would be based on what you guys decide which model you want to go forward on. We are providing, we just had actually last week an orientation for the newly local public health officials, because we're having this transition across the state where a lot of the baby boomers are retiring and we're having kind of new leadership. So we'll do whatever we can to help get your new staff up to speed across the board, both the communicable and other things. And then I was just going to mention, you made the note about doing a time study of WIC. If you need any consultation or TA from our staff at the state office in terms of the WIC program, we'd be fine to help you guys.
Thank you.
That's really all. I think Jim hit it on the head.
Yeah, so basically going out and looking at other models doesn't necessarily mean that something has to be broken. There's always room for improvement. There's always, things that can be learned is kind of the approach that we're looking at. So, yeah, it's good to hear that that's normal and that there's been success with that.
I guess one of the most recent examples that we have is Valley County. We had a public health nurse that had been there almost 30 years, moved to a different county. That led to another identity crisis in Valley, where they did look at all the different options available to them. They did examine the hospital option and examined the more traditional county administered option. In the end, they stuck with the county administered option, but they did change it up a little bit. They hired a non-nurse manager to manage the office, to work with the nurses. But Bruce Peterson is the commissioner that struggled with that, and he did struggle with it. It was multiple months and a couple trips up there to help them through that. But he would be a good resource to talk to about the pros and cons. Every situation is different. They decided that the hospital solution wasn't the best one in their case, but that is particular to their instance. There's other counties that during these things have aligned with hospitals, like Carbon County, Bighorn County. Those have been successful models that we've seen that have been in place for several years and have proven that they can do the work and they do it well. There's others like MAR that struggle a little bit with this due to staff turnover both at the hospital and in the health department, and maybe a lack of commitment of resources. And they struggle a little bit more from our point of view, so we've seen it both ways.
Can you speak to Beaverhead County? I understand they had the hospital model and went back to the county model. Can you share anything that you know about that too, just for information's sake?
Yep. Beaverhead County for a long time was allied and working out of the hospital. And that seemed like a very successful model, at least from our point of view with the programs we work with at the state level. That was a pretty transparent, relationship. We worked with the county health department. Didn't really matter who they were administered from. We all know that they're required to be there by statute, and a lot of their duties are required. At one point, their hospital was undergoing some changes. So it seems like during those growing pains that their hospital went through, where they built a new hospital and their hospital reorganized a little bit, the county then kind of went its own way. Same leader from the county health department made that transition, and I think that continuity really helped, make it at least transparent from our point of view. Again, even though that they're administered by the county right now, we haven't really seen any discernible difference at the state level in how they perform. But it's another county that you might talk to, because they have done it both ways. They've gone back to a traditional model now because of some, issues at the hospital, where the hospital, I think, felt that, the other model wasn't really within their scope anymore now that they were transitioning. But certainly they would be able to talk a little bit more about that. And Sue Hansen is the lead local public health official, and her contact information is on the spreadsheet in there. She would be a good person to visit with too. She could talk about the pros and cons she experienced. I think anybody's pros and cons are going to be very localized to their experience. What they liked or didn't like, might have come down to just one personality in the mix. It might not have any bearing on what your situation would be.
Sure, which is why we'd want to talk to as many people as possible to get more of a general feeling versus just spot checking. So with all of these models, I understand that it's best to have public health in a separate location. Or at least that's what I've heard from one model. So even if it's, regardless of who it's under, having public health in a separate location from the hospital. Can you guys speak to that? Or is that?
I guess I really don't have any strong opinion on it. I know in some of these transitions where local public health staff were worried about losing their identity, they worried that being co-located or buried within the bowels of a hospital would maybe threaten their identity. However, I know in other cases, there's several health departments that are in the same building as the hospital, that have their own entrance, their own signage, and it hasn't seemed to be a problem. So I think it can work, numerous ways here. There's health departments that are under the county administered traditional model, like in Dawson, that are actually housed in part of the hospital, but have their own entrance and own signage, and they kept their own identity, and it really hasn't seemed to be a problem there. I believe Carbon County, when it started out, was housed in the new hospital. I don't know if their office still is or not, but initially it was, and I don't remember that being an issue. I think, again, what it comes down to for some of the staff that we've worked with is real fear of losing the identity of the health department. And I think as long as that identity of the health department can be preserved, as it is in statute, then people feel a lot better about it. But, I don't think it really has any impact on, the program.
Okay. And does anybody here have any questions or concerns they want to bring forward?
Jim, hi. I've met you before. I'm Claire. I work with the health department. I was one of the nurses, and I also am the WIC coordinator. And Kate Gerard wasn't able to come today, but is there any way you guys can speak to the fact of how that contract works and what would happen if the county health department becomes part of the hospital, and what happens with that WIC contract?
Yeah, and when I go back, I'll have to talk with staff. I don't think it would have any major changes. We still, because we have WIC agencies that are health departments with, and other entities, nonprofits and other things, but I'm pretty certain we'd figure out a way to continue.
Because Kate Gerard, when I spoke with her, she said that would go up for bid again. So Townsend, Broadwater County, Jefferson County, and Mara County would be up for bid again.
Okay.
And so when I talked with her, and I did ask her to come, but she had other, appointments that she had to be at. So that's my biggest concern is that, so if the hospital takes over the county health department, we service 140 people. You know, what happens to those people? We have a traveling clinic where we go and see Mara County and Jefferson County, which includes Boulder and Whitehall, and we go once every 3 months for 3 days. So, but what happens to those families? They can't travel. I mean, it's really hard for them. That's why we travel. And I would hate to see those families displaced by this. But that was my understanding when I talked with Kate Gerard, was that that contract goes away because they're contracted with the Broadwater County Health Department under our federal ID.
Yeah, and I guess I can speak to that with our other contracts. You know, again, WIC's not in my bureau, but the preparedness contract, the immunization contracts, those are within our bureau. In those areas where we've seen hospital-administered programs, our contract is still with the county, because the county is the one legally responsible for those programs. Now, the county has an option to kind of sub some of those services out, but our agreement for preparedness or for immunization still remains with the county, so we'd still stay with Broadwater County. So we would not see that changing.
Yeah.
And when we have issues with a contract not being performed or something, you know, we go to the county and work with their administrators at the county on those issues. So we don't lose that identity, you know, with our contracts. I don't know if
The
the
WIC
WIC
is
system's
underneath
different.
the Broadwater County Health Department's federal ID. So it's with the actual health department. So that's just my biggest concern, because that's what Kate had relayed to me that would happen.
Okay, and I'll talk with, it's Kate Gerard and Denise Higgins when I get back, and we'll follow up with you guys, let you know how that potentially would be impacted. But Jim's right, WIC is a little different beast because it's a massive federal program, but generally, we have lots of counties that subcontract different types of public health services to other entities. So I know we've worked it out that way, but I'll find out.
Yeah, and some of this may just be a matter of how they're interpreting, you know, some of those things. I mean, at the end of the day, you know, the responsibility in those contracts, I mean, we can designate, you know, who those are with. You know, ours, at least in our area, stay with the county, you know, even if they're working with the hospital and administering those programs. Sometimes the hospital is just providing that kind of overall umbrella structure and some administrative support for what still is a county program in our eyes.
It's just that WIC is different a little bit.
Yeah, you'd be
Okay,
working
I'll
on
find
it.
out.
We would just like clarification on that, so the public is aware, really, and we're more aware, and the commissioners are more informed about what happens with the WIC program.
Absolutely.
I'm Felicia Head. I've been on the Board of Health, and I've been a nurse in this community for a long time. But you brought up a point of the county health department having its own federal ID. Would the county health department not continue to keep their federal ID even if they were administered by the hospital? Because I see that as two different entities. A hospital-based health department, since you're saying that it's still a county program.
Yeah, I mean, our agreements remained with the county in these other settings, even when the hospital was involved in the administration.
Right, so if the hospital takes over the administration of the health department, does the health department then lose its federal ID and all their funding? Because right now, aren't we in a tri-county funding area? Don't the funding from the state go to Jefferson, Broadwater, and Lewis and Clark?
Not for our programs.
Not for the, just for the WIC program.
Just for the WIC?
So, my understanding is that our federal ID would go away because we would become part of the hospital. So if it happened, Misty and I would become part of the hospital employees. So it would be, that is my understanding.
So all of the financing and everything is all combined then?
No, the hospital, I guess my understanding is that the hospitals don't contribute to the health department. If this model was to take place and be put underneath the same umbrella, it's still our grants that fund us and the county commission, or the county funds us. So the hospital doesn't give us any money. And that's, in our meeting this morning with the hospital and Laura Obert, that was their intention as well, is that they would not fund the county health department.
So what's the benefit then?
Let me just bring us around. There is no one model we're looking at. This is just step one. So there's no intent at this point. This was one discussion. There will be, I don't know, a dozen more at least. And even if you look at a model that looks really good, you still take the pieces that work and discard those that don't. So in my view, I think it would be a danger for Broadwater County to lose that federal ID for public health, because it's still a county responsibility.
Right.
So that wouldn't happen in a model that I would support, regardless of administration, all that. That has to stay with public health in the county. So we're talking wide view here, we're not talking a plan at this point.
Right.
We're just in the investigation
I
stage, and I
guess-
just wanna make sure that's clear.
I guess my thing is, just for my own clarification, what benefit would we get, would, as a community, get out of the hospital administering the health department? Have you looked at that? I mean, as an overview, can you
We're
give a
looking,
statement?
and we've got some information back that there's more we could be doing, that there can be more of a focus on going out to the community, and keeping the doors open at the public health building at the same time. We've also heard just from Roberta, who's the public health nurse in Red Lodge, some of the different things that she was able to do. So that's, again, one model. We'll be talking to these other counties and hearing from them, again, both pros and cons. But I personally would not be involved in any change that didn't add to it more opportunities.
Okay, I have something I'd like to say, and I'd like this addressed. When we have these contracts, the administrator of these contracts gets to take 10 to 20% to run their finances. Is that correct? We have never done that. So if the hospital is the administrator, they can take 10 to 20% of these contracts to pay for their running of the health department, which we haven't been doing now. We've been putting that into our community. Now, I may be wrong, but that's how I see it. That means it's not gonna be a change, but the hospital is going to be able to take 10 to 20% of our grants to run the programs. Am I wrong?
I guess looking at our contracts, I mean, that hasn't happened in every case. There was a time in one of the counties, like Granite County, where they were concerned about kind of tacking on fixed administrative costs, kind of like any college does when we deal with a college. But most of the counties, it really hasn't busted out like that. We ask them for details about how they're spending our money. Most of it's still going to public health staff. And then there's always operating expenses, such as the overhead for the building and stuff like that, which we expect. I'm not aware of with our contracts in IZ, immunization or preparedness, where a flat amount has come out in any of those cases.
I know.
I'd have to dig deeper.
Yeah,
and look,
the
but-
WIC contract, it says, when you do the budget thing, it says that only, I can't remember.
There's probably an administrative cap.
The administration cap of what could be used for the WIC contract, yeah, that they can take it out of there. So,
Yeah.
for administration.
I think it's something to be aware of, when you talk to people about different models, see what kind of, costs they will have. We do know that in some of these models where people have combined, the hospital provided, the space for them and some admin support. That was typically some of the things that the health department needed help with in some of these places where the health department was pretty small. What the hospital charged for that in those cases, I don't really know. I can't tell you the specifics.
Any other questions or concerns, since we have the professionals here?
I'd like to know how long are you gonna run the department? You guys decided not to hire someone as a director, so without there being a director there, is there a way that you can have like a temporary promotion until you guys decide what model you're gonna run with? Kind of like, I work for the Forest Service, but you get a person detailed in there, they get the pay, they get the upgrade and all that until you figure out what, because I know you're looking at the job description as to what you want that to look like, but currently you're running the department without a department head to sign the papers and actually be the person in charge. I don't know how long that we should really run it that way. Somebody should be the director, someone should fill in Linda's spot, regardless of whether it's a permanent position, because if you guys are gonna change the way things run and if the hospital was to administer it or how it works out, but currently you should at least slide someone into, you know, a 4-month, 6-month temporary promotion to be able to fill that position, so it's not just vacant. But they shouldn't be able to, you know, they should get the benefits that come with it.
Thank you for that.
So you don't have an empty slot.
Thanks. We're in process, but yeah, I think that's good advice. We'll definitely look into that. Thank you. Any other questions, concerns? Oh, Joan, I'm sorry, you have one.
I just wondered, now the county owns the hospital, does it not?
Building, but not
The
the
building.
the hospital is Townsend Health Systems. Bill, you were shaking your head. What, can you answer this?
Yeah, it's a private 501c3 hospital.
And there's, Jan, you look like you have something
No,
to
I'm just
add.
on the district board, and the district, I mean, the county does own the building. The building gets leased to the THS, which runs the hospital. So it's two different organizations. One that owns the building, which is a publicly elected board through the county. So the county basically owns it, and then the board, there's a 501c3 organization that we lease it to that runs the hospital.
And the hospital district board is separate from the county. It's not separate from the county, it's its own separate political subdivision. So they do not answer to us, they answer to the people directly. So. Anyone else? Franklin, do you have any questions or concerns?
Oh, well, it seems like the biggest concern is the transition. I think Linda's come to our meeting before. I'll back up one little bit. I've never had any complaints come about the health system, so Linda, I guess you've done a real good job. And she explained things. She's well aware of her staff, highly recommended them. And I'm sure she isn't moving away or she's gonna be gone. She'd be here to give them some expert advice as they make the transition. Does that sound right, Linda? Thank you, appreciate that. And I have a lot of concern for what you mentioned out there, getting somebody there to
The position needs to be filled. at some
take
point.
control of it right now, yes. In fact, I thought that was gonna be taking place, but it hasn't.
Anyone else? Questions? This is a good time to ask them. Concerns?
I do.
All right.
Franklin, are you gonna be participating in any of the visits or communication with other counties and how they run their models, so it's not just part of the commission?
Yeah,
Can you,
probably will, or at least make contacts with some of these people.
that would be great. So then the majority of you will be informed.
Right.
And we've had public discussions, so we've discussed among the commission. In fact, Corey brought it up in a public meeting for discussion, so. this
Discuss
isn't-
what?
On this issue, on what we're doing. So it's not something that's been just kind of quiet. This has been a public, and will continue to be a public process, because not only you guys, but the entire public need to be aware of this. Every step
Well,
that goes through.
this has been pretty quiet. I didn't know a thing about this until about, go back maybe 2 or 3 weeks also, and there's this one email that went through. And up until that point, I had heard nothing.
Yeah, and we're just on the first step. I mean, we've been to one community. There will be a dozen more, but this is just starting.
Well, this email wasn't about the trip to Red Lodge. This is one about the staff that, according to that, it sounded like everything was going straight over to the hospital.
I don't know where you got that from.
Well,
But,
I know where the information come from.
all right.
Could you tell us what your end goal, what do you think your end goal is to change the department from, why would you want it to go with the hospital? What are you looking for? What's the stuff you're searching for going to the other, when you went to Red Lodge? So what is it that you're looking for?
What I'm looking for, I'll just speak for me, what I'm looking for is just information. This is something that's done every time we have a vacancy of a department head. You reevaluate the department. So going to other places, talking to others who are doing the same thing, and kind of picking from their brains and their experience. so that we can determine, are we doing everything we can? Are there more things we could do? Are there better ways to do them? Are there more cost-effective ways to do them? Are there things that are so important it doesn't matter what they cost, because that's what the citizens want? That's all we're doing, is just reevaluating the department. Are there best practices that we could adopt that we don't have right now? Or are we perfect? Is there absolutely nothing more we could be doing? And we could learn that too, through this. This is just managerial, it's just management 101. You just kind of do a look to see, you know, how things are running and can we do them better? That's it. So my goal is to learn.
Like,
And
I'm
then to
just
have
gonna
the
try
best
to hold
public health
steady
office we could.
where everything's at right now without hiring, without filling the director's position and not fixing the market adjustment or any of that, just hold steady until you guys decide what you wanna do with the whole county department as it is.
Yeah, and a lot of times the way it works is whoever's in that department, we have very small departments for the most part. Those who are working in that department kind of pick that up. But I think your idea is one that makes a lot of sense and worth looking at. So we can certainly do that. But as far as making any changes, I don't foresee that we're gonna make any until we're aware of if changes need to be made, and if so, what they look like. At this point, we're just gathering information, that's it.
Well, I think you should also consider the possible, at least getting their market adjustment taken care of so that they're paid what they're there, what they should be.
And I appreciate that. Market adjustments are complicated, but, you know, we'll be having a meeting next week and you're more than welcome to come. We're gonna have a policy, but they have to be affordable in the budget. And there was some misunderstandings of how some of those funds could be used. So
Well, I was
that's,
hoping you were saving a lot of money now that you only have 2 people in the office and not 3. Linda's salary has disappeared, so it should help fix the market adjustment, I would think, because that frees up quite a bit of money for her.
it does, but does it long-term?
It doesn't long-term?
Does it?
Well, I would think so,
Vacancy
if you're only
savings
gonna
are-
stick with 2 positions. Now, if you're gonna hire a 3rd, then it changes, but if you're only gonna stick with 2 positions, it saves that money for the rest of the time the county health department is open.
It
So that
does, and
is
like I
long-term.
said, we're in process, we're evaluating everything. We're
Yeah.
not gonna make a snap decision yesterday just to get it made. We're going to follow the process so that we can look into everything and make the right decision. Our hope is that whoever we have stays as long as Linda does and has the impact that she did in every department. And so it takes a while to make those personnel decisions, especially government, just nothing works fast.
I would like to address the budget thing. Now, you told me back in February, and you told me in September, and you told me just before I left, my budget was very, very strong. And now you're backtracking and saying that it wasn't, and you told me it was a moot point. And I am gone. And so there is plenty, and the county does not pay for our health nurses, our grants do. They have not increased the meal levy for health, public health, and all the time I've been there. And you can find that on paper if you'd like, and present it. And another thing I'd like to address is, you're saying about when the health department is closed. There are multiple positions in this county that their office is closed and people can never get a hold of them. These girls let them know where they're going. They have to go out and do this. They cannot just be in that building. They have to do community health work. They are there usually on Tuesday. And the other departments in the community, their departments are closed forever. Gone to lunch, gone for the afternoon. These girls don't do that. They have to go to WIC. They have to be gone for those 3 days. Otherwise, they are usually there, unless they're out in the community administering immunizations, flu shots, and stuff like that. You can't say that they're not doing their job because it's closed. These other people are not doing their job if their office is closed also. That's my point there.
Thank you for making that point. I don't mean to say anybody's not doing their jobs, and I apologize if that came out that way. It is not at all what I intended. And I apologize that you heard it that way, Linda. That is not what I said, it's not what I meant to say.
Laura, you have said many things to me, and I'm finding that they're not true with what you're saying. And that on the 9th, which was the day my brother died, but I watched the meeting after the fact, you said that I was for this, and I have never, ever been for this, ever. That was not, you do not use my name to further your cause.
You're right, I shouldn't have spoken for you.
Yes, that's right.
We had a lot of different discussions on different things that could be done, and I apologize for any misunderstanding there was on that. As far as the budget, yes, the budget is strong for doing what you guys need to do. It's not strong for what the future looks like for that department, and again, we're working through the process. It is a lengthy process, and we are gonna have to determine what that department looks like before we can expend funds that are long-term into the future. It's a big market adjustment that was asked for. We've got to be able to afford that. And at this point, I'm not sure that we can. So until we go through the process and get to where we know what your department looks like, we're not gonna make any snap decisions. That's, as far as money to operate that department and keep it going, absolutely, we've got that. And that's gonna continue to be a focus. But we've got to at least look at some ideas and that.
You're pertaining to market adjustments. There's been no problem with market adjustments for this last year. I mean, bang, 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 there's been increases.
And that's true. I see everybody else getting them except our department.
Not everybody else. Not everybody else.
Name one.
You know, I think
There's
we're kind of.
there's lots of heads of departments, and I know heads of departments, but it looks like their staff got it too, and we haven't.
You know, I'm gonna kind of take us back to the discussion at hand. I think for sure there could be more communication so that there aren't these misunderstandings.
It would sure
But
cut down
there's-
on the friction.
Yes, I believe it would. And for my part, I'm going to do more to try and communicate. I hope that the commission can as well. I think that's important, but I don't think we can responsibly move forward until we have some answers to some of these questions that we have, so that we know what it looks like that we're going to be providing to the citizens. So with that, is there, Jan?
I have one comment, and it's, I'm an outsider. I'm on the hospital district board. I know nothing about the health department, except I've heard good things. But I'm sitting here in the room feeling it fill up with a lot of emotion that rises from, in my experience over 35 years of working in business, distrust, lack of information, and all of these other things. And one of the things, and everybody may say, well, that's a really stupid idea, and I'm willing to throw out a stupid idea in case it helps. Would it be helpful if, when they made some of these visits or something, to see these things, since there's a concern that there be somebody there that is on our side, is kind of what you're hearing, or at least what I internalized, and that may not be at all what you meant, but that's kind of what I internalized. If one of people from the health department got to go, or somebody who could represent them, even if it would be you, if you could do that, so that they also heard the same things that you're hearing, so in the conversations, they feel more comfortable.
We did do that, I think
You did
that's
do
a
that?
great,
Okay.
yes, thank
Okay.
you. And we'll continue to.
Okay.
Might I say
Support
something?
your-
Might I say something? Yeah. I think it is a good idea to improve the communication. That, like I said, I think that would cut down a lot on the friction. As far as, I'm the county health officer, and I didn't hear anything about this visit to any place until it was over with. So it goes to communication. I think if we can straighten that out, both sides will feel a whole lot better. And I do mean sides, because there's some adversarial positions here.
All right, any other questions or concerns? Nothing? All right. Anything from you gentlemen as far as advice or guidance you can offer us as we move forward?
I guess I would just stress, like I said, when I kind of opened up with this, biggest problems that we've seen in these transitions is lack of communication and messaging to staff about what was going on. So, keep those channels open. I think, I do believe that staff did go to Carbon County, is that?
No, we were not able to go. Laura sent us an email on the 19th, I believe. You know, we're not open on Fridays, and then it was, and they went on December 1st. Our WIC schedule is booked out a year in advance, and so our WIC was already booked for that whole week. So we asked Julie to go for us, and she's a sanitarian, so she was able to go for us.
You know, I think more involvement in those processes, you know, can't hurt anything. I would just encourage people to keep an open mind about it, and I like the idea of, you know, you pick what works, and sometimes, like Valley County decided, after looking at all the options during this kind of opportunity, they stayed with the traditional model that they had. So, I mean, it's normal to look at the options, and we see that when people like Linda leave, because they've been there a long time. So it's growing pains. It's never easy in any of the places that we've seen go through this. But if you can keep talking, then that's gonna make it a lot easier.
Then the only thing I could add, again, I just want to reiterate, is when you guys do hire your new local health official, don't hesitate to get them connected with us. We can get them oriented to our state, funding opportunities for public health. And we're glad to work with staff on any kind of issues that come up. And then, you know, the other thing I just want to do a plug for is, and you guys might already be working on this, so it might be irrelevant, but whether you do a traditional health department the way it's structured here now, or you coordinate with the hospital and do it through the hospital, and I'm sure working collaboratively, the public health folks with the hospital folks, irregardless of how it's organizationally structured, is a very important thing to do. And one example is it might be a good thing to work on, and many counties are, is doing a community health assessment to say what's the health issues and health status of our residents, and what should we be focusing on for the future. We've been promoting health departments working with hospitals, collaborating on that, because hospitals have to do it for other purposes as well. That's the only thing I would add.
Thank you, we're involved in that
Good.
now, so, yeah, that's great to be able to use that as a tool. Thank you.
And I guess we just appreciate the invitation to come out and talk to you guys.
Yeah, thank you very much for bringing this information. We'll make copies for anybody that's interested and have those for you.
Okay. Thank you.
Thank you very much. I scribbled on mine, took notes, thank you very much.
Thank you. Thanks, you guys. Thank you.
Thank you, Lynn. All right, these are, COSs.
I'm gonna give Paul Branch and have her over before, so it's nice to meet you. Looks like you're standing your way.
Bye.
See ya. Yes, you do. This is, we hope this is a moment to leave.
I'll get you a
Very.
copy. Yeah. What'd you say, Jen?
Hope this is an appropriate moment to leave and we're not disrupting your meeting.
No, we're just waiting for our next appointment.
Okay, good, thank you.
Yes.
Who's next?
Next we have Doug Ellis. You know, you can look at this right now if you want. I could just go back to the copies. Yeah, and you can have a copy. Thank you.
I'll take it easy.
Okay, you do, Doc.
Thank you, Doc.
I already talked to Doug today.
Oh.
Why I asked about Minden County Open Hospital. Okay, what would be the difference to have an office in there for the public health? And now.
What else is on the agenda
Building, you
today?
know,
Yeah,
might make quite a difference in it.
yeah, yeah.
Do you guys have what else is on the agenda today?
Doug Ellis is to be here.
And you're thinking about fiscal responsibility.
Under the school, yeah, and
Yeah, thank you.
evidently, well, it's kind of hard to explain. The state says that they have to be somebody that's been in other words, like a teacher in public education, or be superintendent. Most counties, it's always been through, we might have to contract with somebody on that. And, well, it's Corey, he was here when Corey was here, that's table there. And so, and then we've got a closed door, HR person, or something like that is.
Well, can I ask you, I've been gone a lot for fire season, I missed a bunch of stuff, but I don't, have you gotten any farther with, what's the search and rescue building and all that sort, or is that still just a mess?
Yeah, it's not a mess, it's in process also. We finally got a design back from WWC, and that was maybe 3 weeks ago. Nicole had it, she had to review it as the county planner and community developer. She turned that in, I think, 2 weeks ago, last
Have you guys,
Friday.
because when I left, realistically, I left the 1st of September, and I just got home a little while ago, but, last I knew, you were looking at something by the fairgrounds, now we're back over by the dump site. over there
Yes, you
somewhere.
missed a whole lot of stuff.
I missed a lot of stuff.
Yeah, DEQ has 2 months to give, come back with an okay on this. And it's all being done because it should have been subdivided in the 80s and wasn't, so we're kind of going back and picking up what should have been done.
What should have
So,
been subdivided?
The 17 acres out here by the Cedar Canister site.
Right,
Yeah,
okay.
so that is where we're back, and so the end of January we'll have something back.
And so the stuff at
ahead.
the
So
fairgrounds is gone?
That's right.
Okay.
That we went to the city council,
Mhm.
over a period of about 4.5 months, and they just were not interested at that time of
But now we
having
still have
buildings out
problems
there.
out here with the city because they wanted a lot of money originally or something, right?
Well, we're not gonna actually annex into the city. It's our property, basically we let them know.
Or something.
With, yeah, exactly, in a septic. And Julie actually looked at the septic requirements, worked with Mike on that.
Mhm.
So, yeah, we're not gonna annex, we're just doing it on our own. at this
But I
point.
understand that, I mean, that we're still a question as to how big this building is and all that, and then the hospital's gonna get our building.
6,000 square feet is the storage building for you guys. The modular is the same size as
Which
we've been
is, you've already
talking.
purchased the modular, right?
We haven't already purchased it, no, but we have a contract.
Oh, okay.
So, yeah, so
And
we're
that's
just
the
waiting for the
office part.
DEQ. Mhm.
Right.
Yeah, and then your other, the hospital, no, the emergency, emergency,
EEC,
no, Mary Mystic.
Mary Mystic,
yeah.
yeah. She's the director of the ambulance.
Ambulance, thank
Yeah.
you. Yes, they are interested if you guys are willing. If you guys
Well,
are
I've
not
talked to
willing.
Mary about it a bunch of times as far as having her be, a portion of it, because it sounds like there's not gonna be enough funds, and so the new building's not gonna be big enough for us to just move out of ours completely. We still have to have a portion of the building that we're in. Because
I'm not sure about that, but I know some of the worries are along that vein, so we'll have to see.
6,000 square feet, I mean, is it 100 by 60 then?
Yeah,
Right.
yeah.
And so, but that still includes the mosquito board, the weed board, all that, they're all.
Right, but they have minuscule stuff. I mean, weed has a little bit more, but nothing compared to you guys.
Right.
Yeah,
Because our building now is already 50 by 80, I think, and so, and we're too small there, and if you're just gonna get a 60 by 100, and all three of us would have to fit in there. We talked about divide, because it's real easy for us to divide the current search and rescue building in half. I don't know, have you been there in a while? You know what it looks like, right? So they have the new addition with the 4 doors, right? You
Yeah.
put a center and leave 2 doors for the inlets on one side where we have it heated. And then